Hey everyone, this is Dylan here, and today I'm going to go over 4 of the most common questions that we get in the lab from nurses or phlebotomists. So number 1 is pretty much us receiving a call in the lab saying that the patient is a hard stick. How do you want me to collect? And so for our hospital at least, what you do is you collect it in a pediatric bottle. That's going to be your yellow bottle, and that's sufficient. Sometimes you can just do 1 pediatric blood culture. Sometimes you can do 2 as well. But definitely what you don't do is try to start the collection with a normal set and then only fill up 1 bottle and then try to send that to us in the lab. At least for our machine, it's not going to accept it or be able to read just 1 bottle of a set. You need both bottles. So number 2 is how do I collect a fungal blood culture? So to get this one every once in a while, and it's really easy. So the fungal blood culture is simply the aerobic bottle of a normal set. So if you already have a normal set collected, we'll just add it on in the lab, and that means that we change the hold time from 5 days to 28 days or 4 weeks. And if you don't already have a blood culture, then that'd be a bit atypical, but you just collect the aerobic bottle in that case, and then the order would be a fungal blood, so the machine would read it in that case. Number 3 is AFB blood culture, how to collect that. So at our hospital, that's actually not something we do in-house. So it's very niche, specialized test that you're not going to see too often. But we do get that call every once in a while, and that's going to be collected in a special bottle. And then, as I said, we just send it out. But definitely make sure you use that specific AFB bottle. And then lastly, this one we get quite a bit from nurses when we're calling a positive blood. Basically, they ask, why are you calling me? I already know my patient, has positive blood cultures. You keep on calling me. Why? So we have to call in the lab to the patient's nurse every time there's a new set that comes up positive, or if there's a new morphology or microbe identified in a previously called set. So that's why we're calling you. So a lot of times in the lab, patients will have blood cultures drawn sequentially, and then the doctors are trying to figure out, when the patient is free from the bacteria in their blood. So if they're not, if they're quite sick, then you're just going to have blood culture after blood culture that's positive. So we'll always be calling you for each new positive set. So yeah, hopefully you know more about 4 of the most common blood culture questions. And if you have any more questions, let me know in the comment section below. And thanks for watching.